Rages over police funding and responding to mental health calls. San Diego County is trying to expand its mobile crisis response program. ABC 10 News reporter Jared Ahrens took an in-depth look at a similar program in Oregon to see if their model can work here.
As the debate rages over police funding and responding to mental health issues, San Diego is trying to expand the county's mobile crisis response team. We took an in-depth look at a similar program in Oregon to see if that model can work here. For 31 years, Eugene, Oregon has used the Crisis Assistance Helping Out on the Streets, or CAHOOTS program, to respond to mental health calls. The program sends a crisis specialist and a medic instead of police for calls when public safety isn't threatened.
We recognized early on that police officers were not the right resource for that. And so that's what
Eugene Police Chief Chris Skinner says his officers are glad they can focus on law enforcement instead of mental health issues. In 2019, CAHOOTS handled 18,583 calls. That's about 8% of all the calls to Eugene's 911 system. It costs the city just over $1 million each year. Money Chief Skinner says is worth it.
And really, that's what CAHOOTS is it's being thoughtful about matching the right resource with the need that we have in our community.
CAHOOTS is the kind of program that San Diego leaders looked at to try and find a solution here. In the last fiscal year, local law enforcement responded to more than 54,000 calls involving a psychiatric crisis. To help, the county launched its Mobile Crisis Response Team, or MCRT, in January.
The wheel had already been created. We wanted to copy it and make it San Diego.
District Attorney Summer Steffen says the MCRT has already responded to 34 calls and only one needed help from the police. She says that proves teams like this are better suited to handle mental health and addiction emergencies.
This really sets us on a path of longer term, more compassionate, more real solutions that work.
County Board of Supervisors Chairman Nathan Fletcher adds it's part of a cultural shift to start treating these incidents as health issues, not crimes.
If you're having a stroke, you don't send law enforcement as the response. And it ought to be the same if you're having a mental health episode, unless you're a danger to yourself or someone else.
But right now, the program is limited to coastal cities in North County. Steffen and Fletcher plan to expand it county-wide starting this summer. But it's a lengthy buildup to get people hired, trained, and create the infrastructure to support the people they serve.
These mobile crisis response teams need to have somewhere appropriate to take someone to get the care they need. And then when they get discharged from there, we've got to have the permanent housing and the ongoing services and care.
There are also issues with how to reach the MCRT and what types of crisis qualify. Most people call 911, but to get the crisis team, you have to call a crisis hotline, 888-724-7240, a longer number that's harder to remember. The county's working on streamlining the calls so none get lost in the shuffle. Chief Skinner from Eugene says it took years to teach the public and first responders about CAHOOTS and make it their first best option.
Is we answer the phone, 911, police, fire, and CAHOOTS. We give them that option as a resource when they call 911, and then people think, oh, that's right. Maybe CAHOOTS is the right resource for this.
San Diego County leaders hope the success of CAHOOTS in Oregon is something they can replicate here, a new solution for San Diego's mental health problems.
We're moving in the right direction, and we're moving with a sense of urgency. Oh, there's no doubt this is doable. This is very, very doable.
Jared Ahrens, ABC 10 News.
And again, we have the number for the San Diego Crisis Hotline at the bottom of your screen. It is 888-724-7240.